It is always my pleasure to provide science-based information related to your health because health should be your priority. Hi, and welcome back to my YouTube channel, Smart and Healthy Lifestyle. In today's episode, I'm focusing on hypoglycemia, that is, low blood glucose levels for people living with diabetes. Be sure to hit the notification bell. You don't want to miss out on this. So straight to what hypoglycemia is. For people with diabetes, if your blood glucose levels fall below the healthy range, way too low that you're required to take an immediate action to bring it back to the normal levels or to the target levels, then we say you are experiencing hypoglycemia. Usually, for low blood glucose levels, they will be less than 70 milligrams per deciliter. That's like 3.9 millimoles per liter. Every individual has different targets if you're diabetic, so you're supposed to talk to your diabetes care team to help you realize what is your target and what should you be focusing on when you're trying to manage your glucose levels. Episodes of hypoglycemia are very common in people with type 1 diabetes. An average person with type 1 diabetes will even experience like up to 2 episodes per week. There is a situation where people do not experience any signs or symptoms of hypoglycemia, and this is very tricky. But type 2 also can experience that hypoglycemia. Generally, the causes of hypoglycemia will include your medications. For example, when you're injecting too much insulin, or you're injecting the wrong type of insulin, or directly to the muscle, being put on a new routine of medication, or consuming less carbohydrates or foods that are not rich in carbohydrates. Some people usually restrict that because they think by restricting too much carbohydrates, you're going to control your blood glucose level. So add too much insulin in relation to your carbohydrates intake. You're taking less of carbohydrates and you're not adjusting your insulin dose. So you may also experience hypoglycemia. Then people who are exercising, this one will depend with the intensity of your exercise, the duration, and the timing. Too much alcohol, especially when you're taking your alcohol on an empty stomach and you have diabetes, you may experience hypoglycemia. Now, reaction to low blood glucose levels is very different. We say it's individualized. You're supposed to learn your own symptoms and signs by taking regular records or data, having data to know when are you experiencing the episode of hypoglycemia. Most sure way to know if you're having an episode of hypoglycemia is just monitoring your sugar levels regularly. If you have a low blood glucose level, it will trigger the release of a hormone we call epinephrine. That is adrenaline actually. In case you're going to experience symptoms that are related to the release of the hormone, thumping of the heart, sweating. If it is at night, you realize that you've soaked all your beddings. Tingling or numbness of the cheeks, the lips, and the tongue. Shaking too much. Anxiety, irritability, or being impatient. If the blood glucose levels continue to drop, the brain will be deprived of glucose and it will start malfunctioning. The person now may start experiencing symptoms of blood vision. You're not seeing well, slurred speech, talking is difficult, and then confusion. You're so much confused, drowsiness, numbness again. And then if they continue to stay in this state for too long, it may lead to seizure, coma, and in rare cases, death. Other common symptoms will be like dizziness, headaches, vomiting or nausea, and then the feeling of hunger. So to treat low blood glucose levels, we use a rule that we usually call 15-15 rule. In this case, it simply means when you have those mild symptoms of hypoglycemia and you are alert, just take your 15 grams of carbohydrates of simple sugars. Note, we are talking about simple sugars like having a regular soda, half cup of a regular soda, half cup of juice, glucose tablet or glucose paste. After 15 minutes, check your blood glucose levels. If they are still below 70 milligrams, Again, repeat the steps. Take 15 grams of simple carbohydrates, wait for 15 minutes, recheck the glucose again until the glucose level stabilizes. That's when you will be required to take your regular meal or a snack to prevent them from going too low. It reaches a point where there is a severe event, there is an emergency, and you're not able to reach for that, to grab that 15 grams of your carbohydrates. So you require somebody else to help you. So you need a glucagon injection or a puff. Glucagon shot is just simply a hormone that is usually released by the pancreas. Glucagon injection will stimulate the liver to release the stored glucose. In the absence of glucagon injection, or you're not sure of what to do and the person next to you is already in a coma, unconscious and grunting, just call 911. Do not again take insulin injection and inject the person, because you're risking them now to die. Or do not stuff any food, force anything down their throat. They may choke and also die. Just parting shot. If you are a diabetic person, kindly have your medical ID with you. Medical ID is just something that is worn like a bracelet or a necklace that has that key health information about you. So that when you're either in an accident or you found somewhere where you are in a coma, the intervention can be taken as it is. Have regular checkup of your blood glucose level. Monitor them consistently and regularly so that you know when your blood glucose are going below the normal level, and you treat them as early as possible. Check your blood glucose before eating or after eating, before, during, and after exercise, before going to bed, in the middle of the night if it is possible, or if you have a new drug regimen or insulin, if you're traveling, or you have adapted a new physical activity, try to check them regularly. So have your 3 regular meals, snack in between to prevent those episodes of hypoglycemia. Do not skip any of your meal. Liaise with your dietitian to know what is required, when are you supposed to eat in relation to your drugs. If you drink alcohol, kindly be moderate. Most importantly, have data about your food, about your drug regimen or your insulin intake, your physical activities, so that in those episodes where you have hypoglycemia and you don't know what usually causes, you just liaise with your diabetic care team to help you know when they can adjust your dosage, when to adjust your meals, how to advise you. It's very key. Have a diary, have a journal where you keep all your records. I am always your favorite nutritionist, Jamie. Thank you always for choosing Smart and Healthy Lifestyle channel. Bye. I love you so much.